Hi everyone. In this video, we are going to be looking at the topic Simulation Part 2. A previous video on the topic Introduction to Simulation has been uploaded. Kindly look into that video before watching this. Thank you. I'm Sharon. I'm working as an assistant professor at MMM College of Nursing. The following are the objectives that we'll be addressing in this video. Now, let's look at the definition of simulation. It is a process by which we are trying to achieve results approximating clinical practice as closely as possible. It creates a situation or environment to allow persons to experience a representation of a real event for the purpose of practice, learning, evaluation, testing, etc. Now, let's look at the phases of simulation. So before we move into the simulation process, instructions has to be given to the students with regard to the particular topic that we are going to be addressing in the simulation. The theory portion of that topic needs to be over and a test has to be conducted so that the students are thorough about that particular topic. Hence, this phase is referred to as the self-study and preparation phase. Now that the preparation phase is over, we can move over to the simulation process. So this happens in the simulation center. So now to understand, let's see what briefing is. This particular phase helps the students and the practitioners understand their roles and goals, both individually as well as together. And it can help learners prepare for meeting the cognitive demands of the simulation and improve the overall learning experience. Then the next phase is simulation, where the process happens and the student performs the roles that they are earlier assigned to. Then you have the debriefing phase. This phase allows for a structured evaluation of the event, which can help learners learn from the experience and apply it to future situations. This often involves reflection on performance, identifying the gaps, and exploring the reasons for certain behaviors. The next is summary. So here the instructor asks trainees to reflect on what they have learned and apply it to future performance. And after this, a test and an evaluation has to be done. Now, let's move to learning the types of simulation. The first one involves the use of high fidelity mannequins or technologies. This constitutes body blocks or body part blocks with characteristics of life, which can respond to actions or interventions by the students. This is used for representing the clinical reactions, that is, symptoms of a patient, and for describing any conditions surrounding a case. This method further involves the performing a small number of particular tasks or processes, for example, a limb for catheterization of a vessel or mannequin for CPR learning. The next type is partial task simulators. Here, it includes models, that is, sample hands, arms, for implementing a clinical skill task that may be repeated by students. Examples include limbs for IV cannulation, head and chest mannequins for placing an airway, and 4 leather cushions for practicing wound suturing. Now, the next type that we are going to be looking at is using standardized patients. Here, volunteers play the roles of patients. In this type, the trainees behave in a particular way for realistic clinical interactions. It's widely used for teaching and assessment in nursing education, especially for communication purposes and for the acquisition of skills and provide feedback when requested. The next type is e-learning. Here, computer-generated simulators are representations of tasks or settings used for facilitating learning. Simple computer program demonstrating the operation of a device, example anesthetic machine, or something highly complicated, example a detailed setting for virtual reality where the participants interact with virtual patients or other healthcare professionals. The next is hybrid simulation. This is a type where two or more simulation types are combined to produce a more realistic simulation experience. That is, use of portable devices by standardized patients, where students are able to perform certain procedures while interacting with a real person. For example, a standardized patient may fix a suture training model, a cushion, on his or her arm, where the trainee can suture a wound. Thus, while giving the trainee the opportunity to obtain informed consent, explain the procedure, etc. Let's look at the procedure of simulation. It is important to select the role player, select and discussing the skill that is going to be learned in this particular simulation. Planning is a very important phase where everything has to be set right before itself so that there are no confusions during the procedure. Deciding the procedure for evaluation and providing practical session, that is reinforcement on their performance. Let's look at the benefits of simulation. This establishes a setting where theory and practice can be combined. It can be carried out without physical or psychological harm to patients. Controlled teaching assignments are possible. It motivates and involves the students. It stimulates the students for the acquisition of purposeful activities, and they feel keenly interested in role playing, social drama, and gaming activities. It removes the student teacher polarization. Decision making skills are put into action. It gives role awareness. That is, the individual, when he or she plays the role of others, becomes conscious of that role. It also has an interdisciplinary view, providing an integrated view. It is a dynamic framework and it bridges the gap to reality. The next set of benefits are it may be interrupted for discussion and correction and be continued later. It helps in error analysis, discussion on communication related issues, and missed opportunities for optimizing healthcare may become topics for feedback. It also helps in participation in small groups, allowing the students to directly monitor the attempts made by their classmates, improve their methods, and enhance solidarity among them. There is also the ability to manage complex situations and to enhance self efficacy and understanding of interpersonal relations, reduces stress, makes them more confident, enhances psychomotor skills, and makes them ready to apply nursing interventions in a clinical setting. Further helps in error prevention, immediate feedback, and creation of an appropriate training environment where students will feel and actually be psychologically safe. Now, let's look at the limitations of simulation. This is not a low cost effort. It cannot be made in all subjects of the curriculum. It cannot be conveniently used in case of small children. It requires a lot of preparation. It reduces the seriousness of learning. It is time consuming. There is difficulty in using analytic approach. Not all variables related to an emergency in a live environment are included as it is carried out in a controlled setting managed by the educator, who may stop and restart a process, which is impossible in real life. A poorly designed scenario may result in negative learning. How can one maximize learning in simulation? This can be done by self study and preparing before the practice. Pay attention during the practice. Be active in the simulations by trying different roles. Take part in the post simulation trainings by observing colleagues. Be open to feedback and interact in the debriefing. Let's make learning effective and immersive by using the simulation process. The following are the references. Hope this topic has been useful to you. Thank you.